We're going to zoom in to Barnes-Jewish HealthCare Hospital Laboratory to find out more about what they do day in and day out. Laboratory professionals perform specialized tests on blood and other bodily fluids and tissue samples to detect the disease and infection and the chemical imbalances of the patient. These tests are very important in choosing the best way to treat patients. So let's go in and hear a little bit about laboratory sciences.
Hi, I'm Shyla Parrish with Barnes-Jewish Hospital, along with Washington University physicians, serve the city of St. Louis with a mission to care for the underserved and uninsured in the diverse communities of St. Louis metro area, and the hospital is proud to provide urgently needing services to the population. We believe the world's most advanced medicine and breakthrough treatments are only effective if they reach the patient who needs them most. Barnes-Jewish Hospital Clinical Laboratories is responsible for performing more than 10 million clinical lab tests each year, providing clinical data for patient decision-making. Let's go meet the people of the laboratory.
My name is Kiana Dias, and I am a non-reg medical lab technician. I started off just coming in, really just training every day. I trained for about a year. It was tough, but of course, I was told that before I accepted the job. I came in with my bachelor's of health science, and I also had experience in phlebotomy. So being in the blood bank really was just, it kind of tied everything all in for me. Education required for this job would include an Associates of Arts degree or a bachelor's degree. Any student considering my type of job would just have to establish a strong work ethic. That's really with anything you do in life, but the blood bank especially, because it can be a bit chaotic. It's definitely tough. The education and the training is no joke, but it is well worth it in the end. And like I said, you learn something new every day, so that's satisfying overall.
Hi, my name is Ty Flam. I am a molecular infectious disease technical specialist. And what I do with my job is I help detect infectious diseases utilizing different various DNA PCR techniques. I chose my career because this is something that I had a natural curiosity for ever since I was in high school. I always loved science. I loved biology. I wanted to know more in depth of what affects us biologically. And so I pursued that in college, and then I found the opportunity to work here, and it was the best decision I made, just to go for this opportunity. And I'm glad that I'm here and I'm helping with patient care. On a day-to-day basis, what we do is basically we have different instruments that utilize different PCR techniques to help detect the DNA or RNA in certain diseases. The type of advice I would give to a student who wants to go into this type of field, I say it's a very good field to get into because you see a wide range of testing. And if you're a caring person, you love what you do, you love just the natural curiosity of biology, cellular, molecular, all different kinds of sciences, I'd say working in the lab is a good start.
My name's Elizabeth Bianchi. I am the histotechnologist technical specialist here at Barnes-Jewish Hospital. On a daily basis, I get to help with laboratory testing on patient tissue samples. Those samples then help determine a patient's diagnosis, whether it be from determining if they have cancer or not, or if they have a bacterial or fungal disease. We get to help the patients. For this job, if you want to be a HTL, you would need a bachelor's degree in the sciences, as well as sitting for the American Society of Clinical Pathology board certification. Advice that I would give to a student that's considering this career would be to always be willing to be that problem solver. If you love puzzles, this is definitely a good position for you. Problem solving is what we do on the daily, and being able to bring that knowledge forward is what definitely makes it worthwhile.
Marissa Lee. I am a cytotechnologist or cytologist here at Barnes-Jewish. On a daily basis, I do procedures and I screen specimens for cancer and infections. And that can include pap smears, that can include CSF, so cerebral spinal fluid of the brain. It can include anything that you can put a needle in, I can look at it. It's really awesome. This job, you can have a education as a post-baccalaureate certificate, a bachelor's degree, or a master's degree. I chose this career because I am a very visual person, so I learn a lot watching, and I can find a lot of patterns and see a lot of things, and I just learn a lot visually. And this is a very visual field. You're using a microscope all day, every day to find cancer. If you are considering my type of job field, I would say do it. I mean, there's room for advancement, there's room for expansion. So if I wanted to change my career and come over here and be a histotech, I could. If I wanted to go upstairs and be a CLS tech, I could. If I wanted to move up and go corporate, I could. There's a lot of flexibility. There's a lot of different positions that we can fill, so it doesn't have to be all these crazy things. It can be simple. It can be an evening job if you're a night person. It's I don't want to say it's easy because it does take a lot of training, but it is a lot of it's not very high pressure. So it's just an all-around phenomenal job.
My name is Carly Niederkorn. My job title is a medical technologist, and I work here at the Barnes Jewish Core Lab. At Barnes Jewish here, we kind of like to situate ourselves between a bunch of different benches. And a bench is basically like a workstation, and whether that be in chemistry or in hematology. I'm a chemistry tech, which means I kind of work only in chemistry side. The type of education and training required involves a 4-year degree. Myself, I got a health science degree, and it has to be anything within the physical sciences related. You can also do a medical technologist degree where it involves clinical training, and then you can also go straight in to get your certification through the ASCP. Some advice that I would give some people wanting to go in this degree, I would say, stay strong. There is a lot to learn, but there's so much to get out of it, and there's so many different doors that can open up for you, and there's so many different paths that you can go into. You just have to really focus on what you want, and you can really go the extra mile for all the patients, for all your coworkers. You can really do a lot.
My name is Jasmine Ware, and I work for Clinical Laboratories. I'm a lab associate. On a daily basis, we just prep samples for patients and doctor's offices. We make sure the samples are correct, the spelling is okay, birthday, and we make sure all the barcodes are good on the tube so we can run them for testing for the techs. For entry level, we'll give you on-the-job training, and training can last up to 6 months. You can go back to school, and after you complete some kind of credits, you get to be able to upgrade from a lab associate to a technologist. And the personal satisfaction that I get is when we come into work the next day and our supervisor updates about the previous day, that it was no problems with the samples and we delivered in a timely manner. So to hear something like that, it makes the work area more satisfying and positive. Why I choose this career? I like helping people, I like exceeding goals and stuff. And to be a part of an organization like that truly cares about the people. But what advice I would give them, just go for it. You just never know where your future will end up, when you step foot in this organization.
Sam Trentanero. My occupation is a medical laboratory scientist, and my job title is a general chemistry technical specialist. So my daily basis looks like reviewing quality controls throughout the laboratory and general chemistry specifically. However, throughout our lab, we also have many employees that are associate's degrees with an MLT certification. I chose this career whenever I was in late high school. I took a career education course, and in that class, our teacher had us take this online test. It was kind of like a personality-based test, and it would list off options for career suggestions, and I came across medical lab science, and so I looked into that, and 10 years later, here I am. Some advice that I would give to a student would be to set your goals high. I think that seeking out programs that allow you to prepare and try to become certified as a generalist would really set yourself up well for the future. Being a generalist for myself, isn't gonna allow me just to work in chemistry and hematology, but as well, I could work in blood banking, microbiology, immunology, among others.
I'm Chase Groshon, and I'm a medical laboratory scientist here at Barnes-Jewish Hospital in microbiology. On a daily basis, as a microbiologist, we're responsible for reading stains that could point towards infection on patients, and then we also then culture or grow the bacteria that could be causing those infections, and we try to give all that information out to the doctors so they know how to treat patients in the hospital. There's a lot of different routes to get up to be a medical laboratory scientist. The way I went about it was a normal 4-year university and then a 1-year program, or an MLS program. There are other routes such as the military. They have MLT programs, which is medical laboratory technicians, which is like the associate's degree version of that. They also work in the lab with us. And then there's also non-registered technicians that work with us who assist in gram stains and plating and receiving. So there's a lot of opportunity in a lot of different ways to get here. My advice I would give to a student is to remain curious and just have that innate sense of curiosity, especially because in microbiology, things are changing all the time. There's always new answers, new results, and just realize that we kind of act as detectives. So having a good sense of curiosity will go a long way.
Great to see inside BJC HealthCare at the laboratory. Now we're going to go zooming in live to the professionals that are doing the job day in and day out at BJC in the laboratory, led by Jeannie Anderson, Assistant Director of Laboratory at Barnes-Jewish Hospital. Jeannie and team, welcome to HealthCare Career Day.
Hi, thank you. Thanks for having us.
You're welcome. Well, go ahead and give us an overview, and then we'll go into some Q&A with students.
Great. We're going to introduce ourselves and our titles, and we'll kind of go into how each of us got into our selective career fields here at Barnes.
So my name is Marissa. I'm a psychologist here at Barnes.
My name is Rebecca Watson. I am a technical coordinator in the core lab here at Barnes-Jewish Hospital.
My name is Elizabeth Bianchi, and I am the histotechnologist technical specialist here at Barnes.
I got into cytology because I don't know a single person that has not been affected by cancer, and I wanted to do what little I could to help with that problem that we're having as a global society.
I found my career path. I actually went into a 4-year university. I went to school in Kentucky, and I entered as a biology major with the hope of actually going into forensics. And during my sophomore year, I quickly realized that this is not what I wanted to do. And I didn't really know what I wanted to do with this halfway biology degree that I was attaining. So we actually have a medical laboratory science curriculum program at Bellarmine University. And we got a presentation given to us, and it was kind of all the missing pieces kind of came together. It was laboratory work, which I knew I really liked to do. I loved all of my science labs. But I knew I didn't want to go to medical school, and I didn't want to be patient facing, but I still really wanted to have a career that was fulfilling and wanted to help people. And so medical laboratory science kind of gave me that pathway to still help people, but I didn't have to be bedside and patient facing. And so I graduated my medical laboratory science degree, and I started Barnes-Jewish Hospital.
I kind of stumbled upon my career field. I got my 4-year degree in biology from University of Missouri, St. Louis, and did a few here and there jobs. I worked in radioactive chemistry, found out that chemistry was not my thing. And someone pointed out the medical laboratory sciences to me, and I took a tour here at BJC and fell in love with histology. The fact that it's almost like an art form that we get to do every day. You know, we get the tissue specimen, and it's kind of like you're also playing a detective. You're trying to figure out what that initial diagnosis could be for that patient, which then in turn affects the type of care that they receive throughout their journey with what they're going through. So it's very rewarding, and I think that's kind of what I fell in love with. I started out as a laboratory associate and then worked my way up, going to school, back to school, BJC at the time actually had a joint program to learn histotechnology and also work at BJC. And then from there, I sat for my boards and became an HTL, which is a histotechnologist. And then in the past 8 years, I was able to advance forward in leadership and became the technical specialist.
So very diverse path for all three of you, but you found yourselves in the right type of job for you at this moment. Where do you see the industry going as far as, are you seeing more and more technology and automation coming into your place of work, or is it still pretty much the same as it's always been?
Yes, very a big path of progression towards automation in the laboratories. But please don't get that confused as to we are still not needed as technicians. Automation is there as a helping guide for us, but we still need to read the test results and be able to function those automation and those instruments that we use. But it's a very progressive field. You'll see very high-tech technology, state-of-the-art technology, different methods, and as diseases progress and as healthcare progresses, we also have to progress with it. And so it's a very progressive field.
Fantastic. Well, we're starting to get some questions already, so we'll go ahead and send some questions your way. I'll moderate those questions. If you have any questions out there, please put them in the Q&A, and our team will facilitate them as best we can and get them right over to the BJC staff. One student asks, from Spencer High School Healthcare Science, what specific classes are needed to become an MLT?
So you're actually going to start, obviously, with your general, biology and chemistry classes. You'll probably have some organic chemistry classes put in there. But once you start getting really into the medical laboratory technician or medical laboratory science degree that you're going for, you're going to get into more particular fields as hematology classes and chemistry classes, more specific to actual disease states. You'll get immunology, toxicology, and things like that are more specific to what you're going to see in the lab. But you're also going to have those general classes that you'll see elsewhere.
Okay, very good. And we're getting a couple other questions. Another Spencer High School healthcare student asks, have you ever switched healthcare careers mid-path?
I actually switched what I was intending to do when I was getting my bachelor's degree. So I initially went into it wanting to do biochemistry, thinking that I could do more, like I said a little bit earlier and touched on more of the chemistry side of things. Then once I got in the actual career path of working with the chemicals and figuring out things like that, my junior year of college is when I decided to change to just straight biology. So I stayed with the sciences, but I found out that I liked more of the life science aspect of it. And I'm a very hands-on person. I'm a very hands-on learner. And I think that was where I decided that that was a better route for myself to go through.
Fantastic. So once again, it shows that you can change if you need to, or you can stay in the same career path for as long as you'd like. So laboratory has a lot of good options. A couple other questions are coming in. Anonymous student asked, are there more of these types of jobs in hospitals or in private clinics?
As somebody who's worked in both a private clinic and in a hospital, there are all kinds of jobs in both fields. I've worked for a private lab corporation, and everything that we've talked about here, they have in the private lab sector, but we also have those things here in the hospital. But I would strongly suggest figuring out what you want and how you want to best apply your skills before deciding if you want to go private or a more public-facing route.
So a lot of options. I know we have a really good member of the Missouri Chamber. It's Quest Diagnostics, and I've been to their site over in Lenexa, Kansas. They process over 50,000 samples a day there. So if you don't want to work in a hospital setting, you can work in that type of setting, and good career pathways. A couple more questions for you. Trinity at La Plata High School asks, are there any jobs in healthcare that you can obtain at 16 years old? Or do you need to be 18?
I'm not quite sure at 16. I think the earliest would probably be volunteers. You can definitely come shadow and kind of get a feel for it. As far as but actually being an employee, I would say probably 18, especially if you can get into phlebotomy or a lab associate to kind of get that stepping stone and that foundation to see, kind of get a feel on how you like it.
Mm-hmm. You know, I think I've heard from a lot of HR professionals in the healthcare space that say it's a great pathway if you want to go into the healthcare, but you're not sure on where, is starting in housekeeping or in the dietary or in the lunch cafeteria and just get exposed into the different healthcare careers that you see throughout encountering those people every day, asking them questions, and you're getting paid at the same time. And then also, if you stay with them, more than likely you stay at BJC, you're going to get tuition reimbursement.
Yes, absolutely.
So, and you do offer tuition reimbursement, do you not?
Yes, I'm actually in the middle of that. I'm actually in school right now with Barnes to get my master's in business administration. So I'm actually going through that right now so I can clarify that, yes, they have tuition.
Excellent, excellent. Well, I think we're moving into the next part of our program. It's been great seeing you guys, and thank you for sharing a little bit about laboratory science. I believe if they have more questions, they can go online directly to BJC, and you have some resources there that they could access in the career services area.
Absolutely.
Well, thank you so much, BJC, for joining us for Healthcare Career Day. We're going to go ahead and zoom on out to our next healthcare provider.
Thank you.
You're welcome. See you guys.